You are watching Access LaPorte County, Channel 97. Coming up next is July 18th, 2023 meeting of the LaPorte County Board of Health. You can find more information for this meeting by visiting www.accesslaportecounty.org.
Everyone's here. It's 4 o'clock. Today is July 18th. Okay, I now call the meeting of the LaPorte County Board of Health, July 18th, 2023, to order. Roll call, please.
Mrs. Arnold? Here. Dr. Dora?
Here.
Ms. England? Here. Dr. Uhas?
Present.
Ms. Lawn?
Here.
Dr. Manning Cox?
Here.
Dr. Nelson?
Here.
Thank you.
Thank you. So we have a quorum, obviously. Next item on the agenda is the approval of the minutes from the April 18th meeting. Does anybody have any comments or questions about the minutes? If not, I will entertain a motion to accept the minutes from April 18th, 2023.
I move that we accept the minutes from April 18th.
Thank you. Is there a second?
Second.
Okay, no further discussion. Okay, the minutes are approved and accepted. Next item on the agenda is public comment. Do we have anyone here for public comment? Going twice. Anyone here for public comment? Are you here for public comment?
Yes, ma'am.
All right, come on up.
I'm sorry, everyone. My name is John Hausneck, and I'm president of Sunset Septic and Excavating. We do septic work and excavating, and we are involved in the, were involved in the program for point of transfer or point of sale on real estate inspections, and we do property inspections on systems. And since the program went through, since the House bill went through, and we're no longer approved or eligible to do those septic inspections in LaPorte County, we wanted to bring this to everyone's attention and try to get that reinstated with you guys. I know there's a lot of steps to go through, a lot of hurdles to cross, and Amanda obviously knows those hurdles better than I do, but we've done about, we started in 2016 with the program, and we've done approximately about 600 to 800 inspections per year through the program, and we found quite a few systems that were in failure, quite a few systems that there was no septic system per se at all in the houses. A lot of those houses were older houses. Sometimes you found them built in the 30s, sometimes back in the 1800s, and so we were able to correct those systems and make them up to speed. And so we'd like to bring that program back, and we'd like to get that reinstated if at all possible. I don't know if you guys have any questions for me, but you know, we found a lot of systems that were, we were able to pump septic tanks, get tanks pumped, get a lot of the systems up to health codes, current codes, and a lot of those systems were built back in, you know, the 30s. We had a lot of systems. We found a lot of septic tanks that were not watertight, so we had sewage in yards, and a lot of situations like that. So we'd like to get the program reinstated. I'm on the IOPA state conference, and we have 1,000 members in our state association. We have State Department of Health. We have installers and inspectors. We have all different manufacturers, and then also we have people from Purdue University there. So in our association, so we have a lot of resources available, and we'd like to get the program set up really on a statewide program if at all possible. And that's our eventual goal, is to get this done so that every house that sells in the state of Indiana has to go through a real estate or property transfer so that those septic systems are up to speed. So I don't know if anyone has any questions for me, or if you're interested in talking with me later, I'd be glad to talk on the situation.
All right, anybody on the,
I just have a question. So right now, when there's, because I know for the last many years, whenever we had to transfer property, it always had to be inspected. And then I know at this new House bill, whatever, they still don't have to have inspections, or does a mortgage company request or require that if someone was getting a mortgage and cash ones don't have to be inspected? How does that work, Amanda?
So that, excuse me, that depends on a lender. A lender, like usually VA or the housing authorities, the HUD homes, excuse me, they can require inspections, but at a local level, a government level, we cannot, with this new legislation, require any inspections at time of transfer on septic systems. Anything regarding regarding septic systems, whether it was in the health code, a building code, a zoning ordinance, became void July 1st.
so for those of us that are not as well versed in septics, have more of a medical background, let me understand this. In the past, somebody, now I'm talking about LaPorte County, that's what I'm familiar with. Anybody here buying or selling a house transaction had to go through a septic
Correct.
inspection.
Correct.
And the kind of person that was called out to do that was someone like you and your company.
Correct.
And you were, what's the word, registered, certified?
Certified through IOPA, which is our state association.
Okay. So you were credentialed.
Correct.
And now that's gone away.
Correct.
So who does it fall on? I got a couple of questions. This is leading
Yeah. I'm with you.
somewhere, maybe.
I'm with you.
So who does it fall on today if somebody is buying property, a home, and they have to have some place to put their sewage? Oh, who does it fall on? Is it the homeowner that's buying? There's no protection. Before there was a protection.
Correct. And that's kind of a check and balance situation. So the nice part about that was, yes, we were at that point, we were doing a inspection, and we would go through a checklist and check things off, and then we would get the tanks pumped, and we would do a lot of different things in the checklist. And typically it was a 10 to 12 page report. And then also when we were doing those reports, there's a lot of systems that are non-documented. So there's no diagrams of the system itself. So we were able to put those drawings together and send those into the health department. So they had those on file as well. So at least there's some type of a diagram that someone can go off of to see what was going on with the system.
Amanda, who paid for that service back then? Was it the state or the seller?
It was between the seller and buyer.
Okay. And so it will remain so.
It was between the seller and the buyer, and who was going to pay for that inspection, just like when you do a home inspection or any other inspection.
The interesting part about the inspection, and we do inspections, and we've done inspections in Granger, we've done inspections in Hammond, Crown Point, all over Northwest Indiana. The interesting part about this whole situation is in Porter County, and we've helped trained in Porter County, LaPorte County, Stark County,
Marshall
County, Brown County. We've done quite a few. Help the state of Indiana as far as the training goes, and so we've gone through all those training classes with those people. And the interesting part is that even in Porter County today, we're typically doing about 1 to 2 inspections per week down there, and they're not even required down there. But the realtors down there see the importance of having that septic inspection done for the value of just the thought that you're buying a house and you've got a working septic system. So that's what we've come across. I think it's really interesting, the fact that they're not even required, but yet they're still fine. We're still doing inspections at that point.
Well, who's doing the hiring?
Typically it's the buyer. Sometimes we run across the seller, where the seller says, okay, I'm going to sell my house. I want to get all my ducks in a row. I want to have everything lined up so that when I do sell my house, it's good to go.
So it's not the state paying.
No, not the state at all.
So nothing has changed. Either the buyer or the seller can request a septic.
Correct. The only thing that's changed really is it was mandatory
I
at,
understand.
it was mandatory at the point of sale.
Who's got the harm here and who's benefiting? No one, because before it was mandated, but still the same parties were paying for it.
Correct.
Now it's not mandated, and if a homeowner, seller, let's say, or a buyer,
Right.
wants to protect themselves, they're going to have to get a septic inspection and pay for it themselves.
Correct.
We're still where we were, except you're not on a list.
No. The only difference, the difference is it was mandatory.
No, I just said that.
Okay, right.
So
right.
yeah, I mean, we'll get into that.
Okay.
We'll get into what happens if it's not mandatory. I'm just trying to figure out so that somebody doesn't come back and say, "Well, now taxpayers have to pay for," or now.
Oh, no.
No, it's on the buyer or the seller or
Correct.
whoever.
Correct.
So now let's talk about the scenario where somebody's buying a house. Let's look at the buyer who's got the biggest risk. And they don't have a septic evaluation. And then they buy a house and there's problems, like you mentioned, in the backyard. You can
Right,
see it.
right.
A smell.
Right.
Backing up in your first floor toilet.
Yep.
And then what happens? The homeowner's responsible for that?
Yeah, and you can imagine, I mean, if you're a first-time buyer or a new homeowner and coming into it and you're probably mortgaged to the hilt, and then to have to turn around and shell out $20,000 for a septic system.
Not happiness.
No, not at all. Not at all. And especially after you bought the house with the thought that you're buying something that's decent, and then you find out you've got this problem. So
Maybe the entity that has more of an interest in just kind of sweeping this under the rug would be the seller. Because if there was a defect, a deficit, they would be responsible for the remedy.
yes, you're correct.
But this is still not making sense to me why they did this. So let me ask you this. Hypothetically, there's a lot somewhere and there's no building on it. Somebody buys the lot and wants to put up a nice, small 7-bathroom
Yes.
mansion on the lake.
Yeah.
You're the kind of guys that go out there and say, this is the kind of septic you need in this kind of soil.
Correct.
Or you're
Typically, there's a step before that, which is you get a soil site, a registered soil site that's out there
okay.
for soil borings. But yeah, we're involved in this in the process, I guess, so to speak. But you get that soil site that's out there. He tells us exactly what the soil conditions are, what needs to go in there as far as the system goes, and then we can put together all the details.
and you guys work together with that specialty.
Correct, absolutely. And then we work with the health department as well as far as setting it up, getting our permits and getting registered, being registered with the health departments.
At this point, there is nothing preventing people that are selling or buying from calling you.
Correct.
They just don't know that the laws have changed.
Correct. Now, some of the realtors that we've come across have said, we're going to continue on with the inspections because we see the value involved in it. And then, you've got the other realtors who are just wanting to get the house sold and move on and get the job done. So that's what we come across.
Okay.
I think it's very interesting, though, the number of systems that were actually in failure that we've been able to rectify and bring up to speed. And as well, when we're doing that, we're doing a water test also, or a well test and making sure that water is clean and decent to drink. So that program is still in effect, if I'm correct.
So this protects the community,
Correct.
not just a buyer, not just a seller.
Correct.
But people that don't want to live in an area where septics are leaking.
Correct. We've come across a lot of septics that were up in Lake Michigan, different Hudson Lake, Saugony Lake, Fish Lake, different communities like that where we see contamination going right into the lake.
Now, since currently a homeowner or a buyer could request an inspection, what is to be gained by advocating to get you back for certification? What is the benefit to you?
The biggest benefit as I see it, is we do it across the board, and that way, everyone's on the same level. So we don't have some realtors or someone pushing, not doing it. And, that way we know that all these systems or all these homes are qualified to pass the septic inspection.
Are you, business question, and I don't know that
Correct.
much about business.
Fire away.
Are you marketing yourself, you guys? Like, don't buy a home until we evaluate your property?
That's probably a good idea. It's something I've never really, I've never thought about,
Well,
but it might be a good,
well, yeah, because I
good
think
avenue.
most people are like aware of buying a property, and they'll say, "I'll get a home inspection, look at the mechanicals, and
Sure.
look at the roof and the foundation and the studs and all that good stuff." And they're like, if no one's talking about where the sewage goes, I guess that's not an issue, but it is.
correct.
It, yeah,
Until they're not. Yeah, until they're not.
and I'm going to say this too: if people are like weekend people or summer people, and they come from like say, Chicago,
Yes.
we don't know what a septic tank is.
Yes.
We flush and it's in the city sewer.
Correct.
So there's a lot of education over the years that have had to take place and will continue to understand why how septics work and where they go, because we can't just flush and go at this point and go into a city's sewer.
Correct.
How do you get back on certification?
I think that's probably a better question for Amanda. She knows that regulation or rules and regs better than I do, but I know she has to get that approved through the commissioners. And then that will have to go through the TRP program, which is a Indiana state program. And I think I'll let Amanda answer that question.
Yeah, there's a lot of steps to it for anybody in the state, county, city health departments. If you had any ordinance or you want to adopt a new ordinance, you have to get it reapproved through our health board. So I'll be bringing those ordinances back to you next meeting. We also have to have it readopted by the commissioners. It then goes downstate to the technical review panel, and then it's up to that panel whether or not they feel it justified for you to have a local ordinance or not. And they will decide whether it goes into place.
We're not talking about an ordinance to mandate, are we? Right now? Because I wasn't asking how do we get them to mandate. I was asking how would we get this gentleman's company
The same way,
the same way.
yes. Because that's not covered in any state code, it's only in local ordinances.
Okay, so what it would be is an ordinance that says we have entities that are certified on a list that can come out and look at properties for sale.
That would go both for installation of septic systems and also inspections.
Yeah.
It has to be in an ordinance, and we have to go through all those steps for it to go back into effect in our county.
Well, I'm sorry, I couldn't hear the last.
We have to go through all those different steps for us to be able to have that again in our county.
Okay. So we're talking about new ordinances. We're talking about.
Not necessarily. I mean, we already
Well,
have ordinance. It's just updating the ordinance to
Right.
reflect the new codes and to make sure we have everything in there that we want and that we need, or we feel that we want and need, and getting those readopted and then submitted downstate.
So we're going to at some point on the board be discussing about having a list of certified installers and inspectors.
Yes, that'll be included in our ordinance. So yes.
Because right now, for example, this gentleman that was kind enough to come here and educate us, me, anyway, everybody else knows, they would. Well, I lost my train.
So right now, everybody, we had registration we have it for well drillers, for septic installation, for septic inspection. Everybody's registered, licensed, and bonded, or registered and bonded with us. July 1st, it wiped out all the septic. You no longer have to be registered, bonded, certified. If you have a backhoe, you can install a septic
Yeah.
system.
Even for installation, Amanda?
Yes.
Oh, I didn't realize that. Oh,
So
wow.
if you have a shovel and good intentions,
You can install.
hang out your shingle.
Yes, absolutely. So you can kind of see where this throws us at.
So, can we overwrite the state rule then? So how are we doing what he's suggesting? I guess I don't understand.
So that was
If
just-
they say there doesn't have to be an ordinance, or there is not to be an ordinance, how do we create one that overrules that?
So the new legislation last year when they passed Bill 1245, it was to get rid of any local ordinance at all. It was taking away home rule.
Right.
County
All
home
that,
rule.
Yeah.
They must have got enough pushback that they were saying, okay, this year we're updating that legislation. It's still all going away. You can have your ordinance, but you have to have it independently reviewed by a technical review panel downstate.
Okay. Got it.
So everything went away July 1st. There's going to be a large gap of time before you can even submit anything until October 1st. So there's a lot of time in there that's kind of a free for all right now.
Gotcha.
So yeah, that was
I understand where
legislation.
you're coming from then, because I was like, how are you going to change the state law? I think I'm on board now. Okay.
Dr. Cox?
Are there other counties that are also considering?
Your mic, doctor.
Oh, I'm sorry. Are there other counties that are,
You're good.
are there other counties that are considering?
She's not here.
It's not on? There we go.
Okay, thanks.
Green screen.
Are there other counties that are considering, reviewing this as you, obviously, I guess we are now? And how far along are they on this? Have you all thought about joining together in order to approaching, as a unit? Because it might have more of an impact on the legislators down in downstate. And
We're
also,
working actually with a legislative and a representative, and we've got that through IOPA, and we are trying to push for a statewide program through IOPA, and that's our state organization. So we are trying to work with the legislative branch in Indiana here, and we're trying to at least point out to those people what's involved in getting this program started. We would like to have call it a statewide program, but we started in LaPorte County. It's worked out great for our county. I think we've really moved forward decades on the program, and for this it was kind of a kick, and it knocked us down it pushed us back about 10 years in our program, really. Also the fact that St. Joe County has had their own program set up, and so there are other counties around us here who are looking at the program. Porter County has looked at the program. They haven't been able to get their commissioners on board with the program. So that's been a pushback from those people down there. But we have seen at least some acceptance of the program. And we kind of feel like LaPorte County has spearheaded the program. And so we're trying to push the program and get it involved statewide.
okay, and one other thing. I was just thinking about the impact that it would have on Lake Michigan.
Absolutely.
That maybe the region should join together in order, because that would have a big impact.
Absolutely.
Because you can get other states to comment.
To join in with you.
That's
exactly.
right.
Exactly. And I know Amanda's working with the Lake Michigan program, and I'm not exactly sure what the name of that entity is, but I know been on several calls with them also. So they are looking at trying to do something as far as Lake Michigan impact goes, and that's our thought on that process as well.
It seems to me that the previous program was meant to protect the public,
Correct.
the buyer, the seller, the
correct.
neighbors, the water.
Absolutely.
What is the reason? And I'm sure they have a very good reason.
I'm sure they do too. I think the problem was downstate. There was some counties that were trying to push. There's what's called direct discharge. So what you end up with is you're putting sewage through a mini sewage treatment plant, and then you're pushing it out into the water streams and watersheds. And the problem is if those are not regulated or inspected on a frequent basis, and something goes wrong with that you can have problems. Now, over in Illinois, they do those. It's quite common to have a direct discharge. So that was one of the things that there was counties down there that said no direct discharge of these systems. And the problem was there was a lot of lots down there that they were not able to. They didn't have a field system, or they didn't have a good soil to be able to put the sewage into. the septic into after it was treated through a septic tank. So I think that's why we ended up going on this kind of reset button through the state legislative.
So LaPorte County, which is kind of unique in this geographic sense,
Sure.
is also tethered to the wagon of other counties that, if I heard you right, they don't even want septics, they want direct discharge.
Well, it is a septic system, but it's more of a more
It's not pump and haul,
correct.
which what we understand.
Correct. Correct.
They treat the sewage, but then it's direct discharge into like a ditch. So it's, in a sense, they've treated the water, but it's not like, we discharge water underground.
You have to come up to the mic.
Come up to the mic.
Introduce himself.
This is my son, Cody.
Hi,
Hi.
welcome.
So what they're doing is they're treating the sewage through, like Dad said, a mini treatment plant, which is installed in their yard after a septic tank. So they're treating the effluent, but it's not, what they're doing is discharging the water into like a ditch or a stream or something after it's been treated. But where we're treating it, after we're treating it, we're discharging it underground in the soil. So it's getting, then that soil is going to treat the sewage even further before it gets down into the groundwater.
So we have a lot of those systems on lake properties. Lake Michigan, we've got some on
Thank you, by the way.
we've got some of those on Fish Lake.
Lake Michigan.
Lake Michigan is obviously the biggest one that we have.
We have a couple of them here.
Couple in LaPorte. Yeah, we've got a couple over by the fair. One over by the fairgrounds, in fact. So
We don't
But-
have any direct discharge systems.
no, we do not have any direct discharges. Right. Treatment multi-flows or mini sewage treatment
Right,
plants,
absolutely.
aerobic treatment plants. So basically, we're going into a septic tank. From the septic tank, we go into an aerobic treatment plant, which is almost you're injecting air into there, and you've got typically socks or filters in there, and then from there it goes out into a drain field. Now, typically on those, the reason we installed those systems is because the lot was very small, or we had a high water table situation, or there just wasn't enough room for a septic system there. However, there was an existing house there. So we were able to put those units in and treat the effluent correctly, and then be able to maintain the house.
I don't mean to interrupt,
No,
Doctor,
go ahead.
because it is good conversation and good discussion, but we do have to be cognizant of the time because we do have a meeting after us.
Oh, okay, all right.
I'm sorry.
I'm sorry.
No, that's okay. We got off like we often do.
If anyone wants to talk to me, I'd be glad to talk. Myself or my wife or my son, we'd be glad to talk with you guys on it.
Yeah.
We'd be glad to leave you cards. You guys can contact us at any point, and we'd love to discuss this.
Yeah, please leave your cards.
Absolutely,
Yeah.
absolutely.
Well, thank you very much for
problem.
coming out.
No problem.
I appreciate it. Yeah.
Thanks for letting me take up your time.
Yeah, I'm in trouble with Amanda now. Okay, next item on the agenda, Health Officer's Report.
Okay, one of the biggest things that's coming up is the CDC is concerned, as we all should be, about a triple-demic this fall, and has come up with some new recommendations to help forestall it. The concerns are RSV, which is respiratory syncytial virus. Choked myself. COVID-19 and influenza. RSV causes 60,000 to 100,000 hospitalizations yearly and 6,000 to 10,000 deaths in older adults. When I started medical school, RSV was a kid's disease, and you just really didn't even talk about it in adults. But it's become increasingly an issue, and it is there is a significant mortality and morbidity associated with it. So for that reason, a vaccine has been developed this year for adults over 60 to help decrease these numbers. And the new recommendations will be to get a yearly COVID shot, flu shot, and those over 60 also RSV. They don't know, this still has not been finalized whether they're going to be combined, whether you'll end up with 3 shots, 2 shots, and that is, they are looking at. COVID admissions and death have continued to go down. And that part is good. When we talked last time, you asked me the questions whether a new vaccine was coming out, and I said, oh no, it's coming out in the fall. Well, they did suggest that people get another vaccine, but now there's a very specific new vaccine that's going to come out to help to protect against this triple-demic that they are considering about. This is revised, it's directed at the XBB 1.1.5. And again, we just don't know whether you're going to end up with three shots if you want them all, or whether they can put them all into one. That hasn't come out yet. The flu season is ramping up in the southern hemisphere, and that's where we get a lot of ideas of what might happen to us. And the important strains that have been down there have now been incorporated into our flu vaccine, which has worked very well some years, and it hasn't really worked all that well. What they have doesn't necessarily follow up here, but that's how generally the flu vaccine for each year is looked at. It's primarily influenza A, but there's been an increase in influenza B down there too. Also in the news is the malaria. They've had the first locally acquired malaria since 2003. We have malaria that comes in from other countries, but these ones, there was 4 in Florida, 1 in Texas, and it's incredibly low risk to the average person, but it is there. It's something that the communities, hospitals in those areas have to look at, and again, it just reminds us all to do mosquito prevention, both in terms of your yard and yourself, and try and avoid the bites in the first place. There is about 2,000 cases a year of imported malaria in the United States. So, and there's 5 to 10 deaths per year. So, I mean, this is not a major health concern at this point, but it is something that was getting quite a bit, when I was writing this, it was getting quite a bit of publicity. So I just wanted to mention it, that it is something, yes, it's out there, but again, very unlikely to affect both of us, any of us. The next thing is the Alzheimer's disease. And if anybody's been watching the news and listening to what's going on, there is a new medication that has been approved. Until this one was approved, it had been 2 decades since a new medication for Alzheimer's has been approved. And this one does have full approval. So, problem being is that who's going to be able to afford it, and who's going to be able to qualify for it. And those are still things that are being worked out. Medicare says they're going to pay for it 80%, but that still leaves a significant cost, because it's going to be $26,000 a year for this shot. So that's big, and we don't know. And again, it's not a miracle drug. I mean, if it started just at the right time, which they still haven't come to us and said this is the right time, they are talking about tying some significant testing before they'll even allow people to take these medications, which at this cost makes sense. It's not everybody go, I lost my keys, I would like to have this medication. I think there'd be a lot of us up there in line. I have my husband's glasses today because I forgot mine. So that's what. Now, the other thing that just came out over the last couple days is there is another medication that affects Alzheimer's in the same way, and it helps to detangle the amyloid plaques in the brain, and it appears to be even more successful at doing it. It is not approved, it's still in trials, but it appears that it may be even more successful. There's no question, there's no answer, about what it's going to cost when it'll be approved. But obviously, the more medications that come out, if they are equal, usually the price gets driven down a bit. So we can hope that this will make a difference, because it's a huge issue through all communities. It is a public health disease, and somebody described it as the most single unmet medical need in the United States. Alzheimer care and support for the people with Alzheimer, that type of thing. So that's something that I don't know where that's all going to go at this point, but we can all be helpful, because it's a horrible disease, and it's the impact on families and communities is devastating. So right now they think there's probably 1.5 million people in the early stages who might benefit from it. Again, there still has not been you can qualify for it if you meet these certain criteria. That has not been published yet, although they're working on it. And again, the stress for both people with early Alzheimer's and those that are caring for them, and the cost to care for people is truly a public health concern, which is why I brought this up. That's me for today. If there's any questions.
Any questions for Doctor?
Did I hear that the second Alzheimer's medication that you alluded to, that it's possibly going to be a pill form?
Yeah, the first one is injections, and I couldn't find, they're studying both from what I understood from, I just saw it today when I was just, kind of checking up on this, and I couldn't find anywhere in the short time that I had to do it to say whether it will be a pill or an infusion. If you've seen it, I appreciate the knowledge, but I'm not sure yet.
Okay.
Any other questions for Dr. Ducey? If not, I will entertain a motion to accept the health officer's report.
Make a motion to accept.
I'll second that.
All in favor? Say aye.
Aye.
Anyone opposed? No. The ayes have it. Health officer's report is accepted. Administrator's report.
Oh, that's me. Good afternoon. Real brief, real quick, I'd like to introduce our new council. I'm on. Our new council, Laura Nurnberg.
Welcome.
Nelson has moved on to warmer weather. His family and him moved to
Well, it is
California. It is, well,
Yeah, 120.
most of California is, right? So Laura will be representing the board and assisting us with all of our wonderful new bills. And yeah, so welcome, thank you.
Welcome, Lauren.
So a lot happened last quarter. Again, it was the end of the legislative session. We saw good things and bad things. The bad things with that home rule being taken away, and concerns with septic systems, and everybody's still trying to figure that out. There's a lot of ambiguity in there in some areas, and trying to get clarification from legislators isn't always the easiest thing to do, and say, what did you actually really mean when you wrote this sentence? So we're working through some of that. Good things, Governor's Public Health Commission went through, which is a mass amount of money being pumped into public health in the state of Indiana. This first year, next year being the first year we'll get funds, will be $75 million going to local health departments. And it's going to depend on how many counties opt in. Right now, LaPorte County did opt in. Our commissioner signed a resolution last month. It was submitted down to state. So right now we're one of 20 counties in the state that have opted in. So we'll be getting, depending on how many opt in, at minimum next year we will receive $1.3 million, upwards to $1.7 million for our first year, and going after that it'll be double that amount. There'll be $150 million a year available to the local health departments. So just getting on board with what the rest of the nation does is that, even in home rule states, is that the funding for local health departments comes from the state level. 80% of the funding comes from the state, 20% from local, and we get almost nothing from the state unless it's from a grant. The legacy money that we receive right now is $112,000 a year, and that's it. So it's going to open up some more money for the county. We'll still get money from the county, but the largest amount of our budget will be coming from the state. Been working on that budget. That budget is due September 1st. I've been working with the other District 1 administrators, just because this is all new to everybody. We're all kind of in the same boat and trying to throw ideas back and forth off of each other on the programming that we can do, the core public health services we have to provide, and our key performance indicators. So there's a lot going on right now with that. We have to have it submitted by September 1st downstate to have it approved so we can have our money the first of the year and hit the ground running. The technical review panel, when I was appointed to that by the governor in 2019, was it 2019? 2018, 2019, yeah, one of the teens. It was, the purpose of the technical review panel was to have a group of people outside the State Department of Health to review technologies new to Indiana when it came to septic systems. and that this last legislative group redefine the job of that technical review panel, which now includes reviewing all of those ordinances. So not even ordinances, also policies, internal policies for the department to run and concerning septic systems also has to go through them. So there's going to be a lot of work. Every single county, there's 94 local health departments that are going to have to go through this panel to have anything operate within their offices when it comes to septics. And again, this is very brand new for us and for this review panel to review anything like this. So there's going to take some time. Everybody's hoping, and that's what I'm scared to death about, October 1st. You can't submit anything to the state until October 1st. And I just think it's going to be a mad rush to get everything in. Everything will be reviewed by, it'll be date and time stamped, and that's the order they'll be reviewed in. But everybody's going to want theirs done right now, and we got to have it done and push to get it through. And obviously you can only review so many ordinances at once to get them approved. But once the technical review panel, if they do approve the ordinance and policy, it goes into effect immediately. So that's going to be interesting to see how that all works out. And of course, obviously, there's still some procedural things we're figuring out there. So stay tuned. The building, we're still working on that. There's not a lot going on right now. Hopefully we'll get back to work in the next month or so, and we can continue to work forward to be able to be back in the building in October. I wish it was October. Hopefully January, February of next year we'll be back in the building. But again, it's going to come down to the matter of, are we going to be able to get all the materials that we need? Because you think about it, every department that was displaced, everybody lost all their furniture. So it's one thing to order 10 or 20 desks, but when you're ordering 100 desks, just a matter of getting those orders in and at the same time. We'll see what happens. But I will cut it off there. So anybody has any questions, so I can.
Any questions for me?
So in order to get this going forward with what we were talking earlier about with this ordinance, is this something that we're gonna need to meet about again sooner than October?
Not necessarily. I mean, we can if you want to.
It just seems like we want to be ahead of the game as opposed to behind it.
Right. So and again, it's a matter of, I was pushing to get it done by this meeting, but I felt that I was rushing it and I didn't want to miss anything. Because we don't know if we get our ordinance approved, how often we can go back to the review panel to have it updated. So I wanted to make sure that we weren't going to miss anything. And it would be better if it was sooner rather than later. But again, everybody's in the same boat. Almost everybody's health board meets quarterly. And if they didn't get it done this quarter, it'll be done next quarter.
Who's writing the ordinances for our county?
That's why I get the big bucks, doctor. Yeah.
And the luxury office suite.
The luxury oxygen, yes. With yeah. Hey, I have an ice maker, so.
Any of the people?
Turn her mic on, please.
Your mic, doctor.
Do any of the people in front of you have anything to do with that? I think that's kind of what your question made me think of. If we're involved in any of the formulation, then we should probably have a meeting. If not, and we'll just be. Second part of my question, will we just be reviewers?
Typically, the board serves as a reviewer.
Okay.
So it'd be us writing the ordinance, passing it along after it goes through our lawyer, passing it along to the board for review, and then having a discussion in a public meeting and agreeing to adopt it so I can move it on up to the next level, which would be the commissioners.
Amanda, has anyone ever suggested that if in this revised ordinance that we're going to send down to state, that maybe we should take a look at inspecting septics that haven't been inspected for a long period of time, like a 30 or 40 year, or there's a lot of systems out there that long, most of them probably don't function right or correctly, and other than just when a home changes hands or someone, you get a new homeowner, you do an inspection. Should we do more than just that? I mean, should old systems that have been out there for 30 and 40 years and properties never sold, should they be required at some point to do an inspection?
There was a lot of discussion about that when we had our ordinance that passed in 2012. We put in the operating permit section of it, and it was at that time was trying to catch the new systems that were being installed, because it was almost a daunting task to go back to all of those systems, whether we had records of them or not, and to have them inspected. Going forward, that could be an idea. That's something that would, maybe not right now, but it is definitely a good idea. Again, it is considered, septic systems are considered a non-point pollution source. We know there's E. coli in the water. We know that that's probably coming from septic systems, but you can't really pinpoint it, right? Unless you're dye tracing, and not even that always works. But we know that is a cause of contamination to ground and surface waters. So, yeah. I mean, there's a lot of entities out there who would love to see that. DNR, IDEM for one, EPA would love to see that. But I don't think Indiana's quite there yet. But yeah, it's a good idea.
You think that perhaps private property owners might resent the fact that the government's coming in and they've had no problems reported, and they just have an older septic, and then now the government's going to inspect their septic without being asked to come in?
Even in, I've noticed in Beverly Shores over the last couple of years, just being up with friends and stuff out there, a lot of them have yard signs that say, be a good neighbor and get your septic inspected every other year. Have you seen those signs?
Yeah, it was a big
thought it was a great idea
educational.
if people could all get on board with that.
Yeah,
But
I
usually
think-
people that know that their septic's failing keep it quiet.
Well, and
Exactly.
again, I'm not saying it's not a good idea.
Yeah.
I'm thinking in more remote parts of the county to send a letter saying we're coming in and looking at your septic, and if there's a problem, you're going to have to fix. Yeah, they should fix it, but I don't know how that's going to play.
Right. So, I mean, that's where it was starting with that operating permits, and then the property transfer. That was the idea behind that. We get anywhere from 800 to 900 septic inspections, IOPA septic inspections a year for property transfers, and we follow the national average of 11 to 13% of those being a complete failure or no systems at all. So it was that 80 some odd systems a year that are in failure. So yeah, over the last 8-9 years, there's been quite a few numbers, some big numbers there. Yes, doctor.
Okay, thank you. In that case, are you going to give us information that we can look at, or sources, so that we can at least be more up to speed on what the regulations are, how Congress, I was going to say, but how downstate look at this, just to give us a historical perspective. So that we know what we're looking at, some of the questions that we might have, since all we're going to do is to pretty much kind of rubber stamp, but at least we'll have some idea ahead of time to know what's going on, what you're meeting on, what you're proposing, how the ordinance will be written, so that when we review it, then we looking at it as with knowledge rather than just cold. And another thing too, maybe putting that in about the inspections, so that people can see what's coming. But in actuality, those other properties will not be inspected for years. Those people will probably die before those properties will get inspected. Mm-hmm. But at least sometimes with the knowledge that that is available to them, if somebody complains in the community, then that might call to question whether or not this property should be inspected. And that could put on other people, well, let me look at it first. I'd rather be knowledgeable about my particular area, and let me see that I can keep up with my septic system. And it's a lot cheaper in keeping up and checking things out than it is all of a sudden you come with a complete failure and you have this amount of money that a lot of people in Indiana can't afford to remedy. So, so I would like to just see that in the ordinance, that is something that we will look at, but knowing that we will not really touch that for years. Do you see what I'm saying?
I think I'm following you. I'll get you as much information as I can.
Okay, great.
Very good. Any other questions for Amanda? If not, I'll entertain a motion to accept her report.
No, Mrs. England has a question.
Sorry.
Oh, I'm sorry.
No, you're fine. This may seem like a silly thing, but I was looking up, like the average income for LaPorte County. I don't know how much septic repairs cost. I don't know how much septic replacements cost. Like, what are we going to do if some of these remote people, I mean, let's just face it, people don't make that much money. Sometimes they're really, living paycheck to paycheck. What if their septic is failing and the county comes in, or not even failing, but, they get a letter saying, hey, we're going to come in and inspect your septic. They can't afford it. Like, is there any financial assistance or way to offset costs and stuff? Like, I kind of see how it could be mandated with the sale of a home. And even then, with the seller's disclosure form, I think it really should fall back on the seller, to disclose it or be responsible for fixing it. I can't really justify it for cash to cash sales. However, that's my personal opinion. But coming out to these people and saying, hey, we're going to inspect your system and the cost is on you. I mean, these people don't make a lot of money. So how is that even justified? Like, without saying, hey, if your septic is needing repairs, we're not just going to throw this cost at you. That will somehow help you with it. Like, I don't know, how is that going to work? Because a lot of people in this county are not making very much money.
So you're talking about mandated inspections for every homeowner?
Yeah, like we were saying, like, hey, you're going to get a letter that we're coming to inspect your septic. All these people in the remote parts who haven't had it inspected for 30 or 40 years. Like, my biggest thing is the government overreach again, because I'm so against that. And I get we all want to get on board with having our neighborhood safe, but how can we just throw this cost at these people who what if they can't afford it?
So I don't even see that even happening in the state of Indiana for 20, 30 plus years to mandate an inspection coming in. Right now by legislation, we cannot knock on somebody's door saying, hey, we're going to inspect your septic to see if it's working.
Because like the mandation, I know we were talking about for the sale of a home, but then we were discussing eventually going into the houses that maybe haven't had it inspected in a very long time. And so I'm just sort of throwing that out there, because once you mandate it for the sale of a home, just to, keep going to the areas that maybe need it is fine. Like, I get that. But it's also a lot of cost incurred on the homeowner.
So there's a lot of different levels to that. There is rural assistance programs. So basically, if you're on a septic system, most areas in LaPorte County, you do qualify for aid. To assist with that, depending on your income and such.
Yeah.
I mean, septic systems, if it's not properly functioning, you're talking about human waste contaminating drinking water, surface waters. So there's a definite public health issue there to that. A lot of it, like what John said before, it's out of sight, out of mind. You're flushing your toilet and you think you have a septic system or you don't. Or we've come across systems or people, especially in the lake communities, are flushing the toilet, goes away, system works, but it's a straight pipe going out to the lake.
Yeah.
Stuff like that.
Yeah, and I completely agree that as a public health issue, it needs to be remedied, but I'm also, I care about the cost for the homeowner that they may incur out of nowhere. And if there's aid, great. I don't know that. I didn't know that. So that's fine, yeah.
Yeah, this is the rural assistance program.
Okay,
so
good.
Yeah.
Okay, good.
Real good.
Okay, any other questions or comments? If not, do I hear a motion to accept the administrator's report, please?
So moved.
Is there a second?
I'll second that.
All in favor?
Aye.
Aye.
Anyone opposed? Okay, the report is accepted. Environmental Health Food Division Supervisor's Report.
Good afternoon.
Good afternoon.
Can you hear me?
Yeah.
Okay. The fair is over. I want everybody to know that the fair is over. We're very glad that the fair is over. It actually went pretty well this year. We had a few incidents. We had only 3 new food vendors at the fair this year. Everybody else has been there multiple years, so the 3 were a little challenging, but we got through it and hopefully got them together enough. We didn't have to close anybody, so that was good news.
Right there.
Now going back to the second quarter where I'm supposed to be, but normally people are interested in the fair, so. There were 64 septic permits that were issued in the second quarter, 54 well permits. We did take in 361 water tests this quarter, even though the lab is still closed, but those are all being outsourced to Yes Labs in Mishawaka, so we did collect 361, so that's quite a few. The beach sampling is going pretty good. We've had 6 advisories in the second quarter, 3 at Lower Fish Lake, 1 at Old Stone, 1 at Upper Fish, and 1 at Stop 31. The intern is still with us until early August, so she's still doing those samples. The health education, they gave away 13 car seats. They distributed 271 doses of Narcan. 6 Narcan trainings took place with 3 health education events, and those are all just ramping up for the opening of school, so those have just started. 32 environmental complaints were dealt with, 35 pool inspections. So those included year-round pools and just the seasonal pools. The mosquito program, surveillance program is going well. They did have to not collect during Fair Week because there just wasn't enough people to do that. But there have been no positives for West Nile or Triple E. The first day we sampled was May 17th. So those are being collected 4 days a week. There were 285 food inspections that were done, 4 food complaints that were done, and we've been very busy with temporary events with 86 inspections so far. But we haven't even got to the busy part that all starts after the fair. We had 48 temporaries at the fair. We do have 4 court cases still with the attorney that are still being worked out, but hopefully those will be resolved. Questions?
Where are the public pools? It says in your reports that there are 25 public pool inspections. Where are public pools?
Public pools are pools that are at campgrounds, hotels.
Okay.
Those are the public pools. They're all permitted and they all are inspected.
Any other questions? Any other questions? If not, I will entertain a motion to accept the report. Do I hear a motion to accept?
Motion accept.
A second?
Second.
All in favor?
Aye.
Anyone opposed? No one's opposed. The ayes have it. Nursing supervisors report.
Good afternoon.
Good afternoon.
We started this quarter with 2 of our staff members attending Immunization A to Z training class in East Chicago. This class educates about all of the childhood vaccines and their indications and schedules. We had our annual immunization site visit at our Michigan City office in May. The state comes and reviews our vaccine storage and handling procedures, patient charts, and the program in all, and found 0 violations. We have to have a site visit every 2 years to maintain our enrollment in the Vaccines for Children program through the state. The CDC issued a health alert regarding measles. This just happened this week. There have been 16 cases of measles within the first 5 months in the United States this year, compared to 3 at the same time last year. They're finding most cases in unvaccinated children who have not received their MMR vaccines. So they're urging everyone who's going to travel internationally to make sure they're up to date on their measles-containing vaccines before travel. And kind of just mentioning a little more about the RSV, the U.S. Food and Drug Administration approved a vaccine called Arexvy. That's the first RSV vaccine approved for use in individuals 60 years of age and older. And it's going to prevent approximately 60 to 120 hospitalizations and 6 to 10,000 deaths among individuals 65 years of age and older. In the second quarter, we saw 30 clients for a blood profile. 7 families came in for Cribs for Kids education. 259 individuals were seen for immunizations, with those individuals receiving 482 immunizations in all. We performed 8 lead tests and followed up on 7 elevated blood lead levels with 3 home visits performed. We saw 16 clients in our confidential services clinic. 113 clients were seen for TB testing, and 8 clients were seen for international travel vaccines. I just want to briefly talk about, we are transitioning to using an electronic medical record system. We've been training on this for several months, and we are scheduled to start using that this month. It's been a learning curve, but I think in the long run it'll improve our documentation. And I think that's it, unless anyone has questions.
Are there any questions?
I do. These lead testing, do you find that it's like homes that are owned or rentals?
A lot of rentals.
You're talking about lead? Okay. Any other questions? If not, do I hear a motion to accept the nursing supervisor report? Anyone? Okay, is there a second?
Second.
All in favor?
Aye.
Aye.
Anyone opposed? No one's opposed. Nursing supervisor report is accepted. Attorney's report.
Good afternoon, everyone. Thank you. So as Ms. Wozniak noted, I think you said there are 4 files. I'm still trying to reconcile that. I have 2 that I filed motions to dismiss on back in the middle of May, I guess, and those went through. So that seems to be jiving. And there are 2 more that I'm going to file motions to dismiss on because they've either been remedied or we've gotten to the end of the rope. We can't go any further. The rest of the information, we're still waiting for updated records and things like that, just to make certain that it meets with the department's approval. If it's satisfactory, then we can dismiss those as well. I think one of the things that we're seeing is the confusion regarding the new legislation. That's indicative of the problems I'm having getting a hold of the individuals who are represented by counsel. So I'm still trying to finagle my way through that, and I will keep working on that. But so far, I'm hoping to reconcile my records so that I have 4 as well. So knock on wood, I think we're going to get there.
Very good. Thank you and welcome
Questions?
again. Anybody have any questions or comments? If not, do I hear a motion to accept the attorney's report? Dr. Dora?
Motion accept.
I'll second that motion.
All in favor?
Aye.
Aye.
Anyone opposed? No one's opposed. Attorney report accepted. Any old business we need to discuss? No. Any new business we need to discuss? No. Okay. You guys, next meeting will be in October. And I could suggest the 17th, which is a Tuesday, at 4 p.m., October 17th. How does that work for Dr. Dora? Does that work for you?
Yeah, just say. Yes, that works for me.
It's the one Tuesday in October I'm on call for.
Is that the one you're on call?
Open the 3rd, 10th, 24th, and leave Halloween.
Okay, yeah. 10th,
Try the 24th.
3rd, 24th. Let's do the 24th. Is the 24th good?
That's good for me.
Anybody have a problem with the 24th? I'm good with the 24th.
We still can zoom in, correct? If for some reason someone can't make a meeting, if they are.
I expect that we should be able to. I see it set up.
50%, you gotta attend what, 50% of the meetings in person?
Yeah, live.
One year you're allowed.
Although now we can have ChatGPT render us an AI and you won't even know I'm not here. All right, so we've got a date, October 24th, Tuesday at 4 p.m. for the Board of Health. Any other questions, comments, or concerns? Or do I hear a motion to adjourn?
Question.
Yes, ma'am.
If we're going to have this meeting in order to, I'm sorry.
It's okay, it's good now.
Thank you. I apologize. If we're going to have this meeting, that we're going to stamp approval for the ordinance before October 1st, so that we can be the first in line downstate to consider the septics and approvals and so forth. When will we have that meeting?
That's up to the board. If you want to have a meeting prior to October, we can do that. Otherwise, we can just do it at the October meeting.
Why not just pass out the revised ordinance as you see it, and then we can discuss it when we come in October 24th, rather than summon everybody from work and home to come in.
Mm-hmm. Okay.
Is that okay with you?
Yes.
Is that okay?
And I'll get it to you in plenty of time so you have time to review everything, and
Right.
there'll be a
you can
test when
review
you
it.
get here.
Just what?
Nothing.
I didn't hear that. So funny. All right. Is that it? Is there a motion to adjourn?
So moved.
Okay. Is anybody second?
I'll second that motion.
All in favor?
Aye.
Aye.
Any noes? We are adjourned.
No, I was saying.